Welcome to Better Sex, where you get the information and inspiration to create and enjoy your best possible sex life. Join your host, sex therapist Jessa Zimmerman, as she brings you expert guests, helpful tips, knowledge, and strategies to improve your intimate relationships. And now, your host, Jessa Zimmerman.
It's Jessa back for another episode of the Better Sex Podcast. Thank you for tuning in and being along with me for the ride. I am home today with a snow day, so I apologize if my sound quality is less than optimal. I did not have my nice fancy mic with me, but I decided to go ahead and record my shows anyway. Makes me realize how much I wish this was my life. I have so much fun having these conversations, and this is what I'm doing all day long, and it would be lovely if I could have even more of them than I get to do. But so be it. It's not my whole life yet. I would invite you, if you are enjoying the show, there are a couple things you could do to support it. And maybe that would allow me to do more of this. I don't know. If you like the show, it would be great if you went into iTunes and found the show. You can actually go to bettersexpodcast.com/iTunes. That'll take you to the link. And leave a review. Rate the show and leave a comment, leave a review. That helps other people find the show. So that would be great. The other thing you can do to support it if you're enjoying it is to join me at Patreon. And you can find the links for that also on the podcast website, so bettersexpodcast.com. It allows you to pledge a small monthly amount in support of the show. So there are different levels that you can pledge with varying sort of rewards or thank yous that go along with them. But at any level, $2 a month and up, you get advance access to every single episode. So I sent it out via email. It doesn't have the opening and the closing on it, but you've got the whole interview a few days before everybody else. So if you're enjoying the show, I would really invite you to join me there. Today's topic is, like some of them, not going to apply to everybody. But hopefully will it be interesting. And actually, I think there's a way that this is important because it's about advocacy and allyship, as well as the specific situation we're going to talk about. So Dr. Sheila Addison is my guest today, and we are talking specifically about what is it like for cisgender folks to be partnered with transgender folks. Now, we're going to define those terms, and, we start from the beginning at this, but basically, if you are somebody whose gender identity matches what you were assigned at birth, they said, oh, it's a girl, and you feel like a girl, you're cisgender. And maybe you're partnered with somebody where that's not been the case. And they're either transgender, man or woman, and you're in a relationship. And there are specific challenges to navigating that, issues that come up around sex, around intimacy, and even just relationship stresses and, like I said, being allies. So anyway, that's the topic of conversation today. And I realize that not many of you listening to the show are in this situation, but you may be, or you may know somebody that is, or maybe you just want to get on board being an ally for some of the rights of people that are more marginalized. Anyway, it's a fascinating conversation, and I hope you enjoy it. Sheila, thank you so much for being on the show today.
Yeah, thanks for having me.
Yeah. Maybe we could start with the basics, because I think listeners have varying degrees of education or knowledge about this. What is transgender versus cisgender? What's the definition of those terms?
Sure. So I think probably more people are familiar with the term transgender. Transgender is a term that describes kind of a variety of folks maybe under that umbrella, but all of whom experience their understanding of their own gender as different from the gender that they were assigned at birth. So something that has happened to pretty much every single human being alive on this planet, including the people listening to this podcast, is that they were born and then somebody in the room said it's a boy or it's a girl. A small number of people are born actually with a condition that we describe as intersex, where it's very difficult, perhaps, or ambiguous to determine what their gender is. But for the vast majority of people, they get assigned a gender. And what that usually is based on is looking at the genitalia of the baby.
Yeah.
Only characteristic that's used, right? So if the doctor says you're a boy and you grow up thinking, yep, that's pretty right, I'm a boy, which is an experience that the majority of people have,
Right.
as far as we know, that means that your sense of your gender identity fits with the gender you were assigned at birth, what the doctor announced and put on your birth certificate. Because those things are the same, the term cisgender was coined because we already had a word for the other experience when your sense of your gender doesn't match what the doctor said at your birth. And that the word that was developed to describe that was transgender. And so at some point we kind of realized, well, there's two conditions here, right? There's being the same and there's being different from. And if we've got a word for being different from, we need a word for being same.
Yeah.
So we actually, I think the people who coined the term looked to chemistry, which is where the trans prefix meaning different or on the opposite side from came from, and said, well, the corresponding term is cis, so on the same side. So if how you see your own gender is the same as what the doctor said when you were born, you are cisgender. I am cisgender. If you are different from that, your sense of your gender is different from what the doctor said, you may fit under the umbrella of transgender.
Okay. So would you, this is not exactly a detour, but a slight different than we're going to talk about, but the overlap between intersex or these disorders of sexual development where people are not clearly binary male or female, and the overlap with transgender, to what degree is there overlap? Or, they're distinct things going on.
Yeah, they're kind of different situations, but you're right, there may be overlap. And I don't have, exact numbers there, although I can say this. If you have ever met a redhead, you have met an intersex person, which is not to say that all redheads.
Yeah, that makes it sound like redheads are.
No. Right. What I'm getting at is this: the incidence of children being born redheaded is about the same per 1,000 births as the incidence of people being born intersex.
Right.
The incidence, by the way, of people being transgender is about the same as the incidence of twins. So if you've ever seen twins,
okay,
you've also seen a transgender person, right? So intersex folks, because the way that our society works is babies come out and we say it's a boy or it's a girl.
Right.
Most intersex folks, whether it's immediate or after some consultation with doctors, are assigned a gender. The doctors say to the parents, this is what we think you should do about your child's gender, sometimes up to and including some fairly radical and invasive surgical procedures to try and make children look the way we think that children of that gender should look. And so for some intersex people, they grow up more or less identifying with that gender. The doctor says, you should treat this child as though she's a girl. And the person grows up feeling, yes, I guess that's right. But some intersex people do not. They feel different than their assigned gender, which then does put them perhaps in that transgender kind of umbrella. Certainly an experience or a piece of the sort of gender picture that both transgender and intersex people can share and relate to is that they do not fit neatly into this kind of binary or this, two very separate and distinct tick boxes, which is how most of us have been brought up to think about sex and gender. You are one or the other. You're very clearly in one box and you stay in that box all your life. And both transgender and intersex people's lived experience really complicates that and kind of raises a lot of questions about why we are so attached to that idea of the gender binary. But that's a lot of where the contact is too.
Yeah. And so it just seems to me that some transgender people have, I guess, what we would call, I don't even know how to articulate this. They had genitalia at birth that seemed to indicate a particular gender clearly, and yet don't fit that sense of themselves later, right? And then intersex people maybe were arbitrarily almost assigned a gender.
In some cases.
In some cases, and then don't feel aligned with that later. So the topic today is, what about when a cisgendered person is partnered with a transgendered person, and what kind of challenges that might bring to relationship? And then I'm specifically thinking how different might those challenges be if that transition is happening while they're together versus something that had happened before they met, right? So that's kind of a big umbrella question to throw at you, but what are some of the
Sure.
issues that people face?
Well, first, I just want to point up a little piece of language. And this is something that I think a lot of cisgender people may feel very anxious about. So I want this to be for everyone. It's very common when I talk to cisgender people about gender identity related issues and also sexual orientation issues, which are separate, but also under the kind of queer umbrella, for people to say, well, I just can't keep up with the language because, I say one thing and someone says that's wrong. And then they tell me to say another thing. And then all of a sudden someone else comes along and says, no, that's the wrong thing. And the reason I say that is you described cisgendered people and transgendered people. And that is a kind of language that 3-4 years ago was really fairly common and is pretty common still in some parts of the professional literature. And now our thinking about that has evolved to see transgender and cisgender, as an identity and not a condition. So we just talk about cisgender and transgender people. And I, to bring myself into the conversation, I have been teaching and training about sex and gender issues for many, many years. And I'm always going back through archives, of mine, digging things out. What was that handout I had for this class 10 years ago or whatever? And inevitably, and I read my stuff before I, update it and share it, but inevitably I, share a handout and somebody goes through and says, well, you are using a term that is very out of date. And I go, yep, there it is. Because when I developed it, that was the term we were using. And now we don't use that. We use something different. And, and this happens literally all the time. So it's something that I want to encourage both cisgender and also straight or heterosexual people to kind of take a deep breath and try and relax a little bit about. Nobody's doing this to upset you or to make you look bad. It's just a very dynamic and evolving kind of situation right now. So
I appreciate the clarity, because even as a sex therapist, it's not always. No, it takes a lot of thoughtfulness and intention.
You're not on the email chain where you get the monthly update on.
Well, and the awareness and the education and to keep abreast of it. So it's
right.
It's well taken. And I agree that everybody listening is going to need that kind of patience and, awareness as they move forward.
Yep.
Okay.
And so in terms of cisgender folks who are having sex and relationships with transgender folks, that's actually like a really good place to start, which is that learning about gender identity and gender difference is something that I wish all of us did. I wish we had comprehensive and developmentally appropriate sex education all the way through our schooling, public and private, and certainly in the United States, that is not the case. And so it's, for most people, and I mean, especially once you're an adult, most of what people are learning is very like catch as you can. If it's of interest to you or concern, maybe you learn something or maybe you read something, in a link somebody's passing around Facebook, and maybe you don't. So as cisgender people, we have the privilege or the advantage of not having to think too much about these kind of complex and emerging issues around gender, because we just get up in the morning and gender is kind of, working for us and we go on about our day. So it really is important, I think, for cisgender folks to, first of all, realize that there's a whole big conversation out there, and that's partly transgender people's lived experiences and professional conversations, including trans professionals in particular, trying to kind of get heads around, how do we make sense of these varied and different experiences, and what are some commonalities and what are some differences. So I think that that's actually a really valuable place to start. Reading blogs and books and personal stories by transgender people of all kinds, because there are many different kinds of transgender folks.
Right.
Following, people on whatever your social media is, Twitter, or Instagram or Facebook, and learning, kind of what's the lay of the land? What are people talking about? What are the stories that are out there? I think is a really important kind of place to start, because one of the things that you learn about when you do that is you learn about what trans people have to say about how to talk about and how to treat their bodies. Now, because part of the transgender experiences that many people have is very complicated relationships with their bodies, maybe really uncomfortable feelings about their bodies, it's a very sensitive and personal kind of subject, which by the way, is true for cisgender people too, right? We don't all go around like talking to perfect strangers about what's in our pants and how we feel about it.
Right.
At least I hope we don't. But when transgender people are willing to disclose and to share their feelings and their preferences and the language that they want to use to talk about their bodies, this is really valuable information. And what this helps us do as cisgender people is to come informed enough to ask some good questions, right? Just because one transgender person says, this is how I talk about my body and how I want my body treated, doesn't mean that's going to be true for every person.
Right.
But if I know this is an experience that some transgender men or some transgender women have, this is some language that some people use, then I can ask a person if I am involved with them or, considering getting involved with them. This is my understanding for some people. Is that true for you? What is true for you, right? We're informed enough to ask good questions.
Yeah.
So I think that's an important place to start, because relating, intimately to people who are transgender, inevitably means navigating, having relationships with their body and our body. And I think it's particularly important to understand that may go very smoothly, and it may be not particularly different than navigating that with you and any other person that you're just getting to know intimately. But it also might be new and different for you, and it might be challenging for you, and it might be challenging for the other person. And to be prepared to be patient and kind and curious about that
Right.
as intimacy is developing between you.
Yeah. And here I'm thinking there may be some difference between, again, people that maybe transitioned before we got together and have become comfortable. Well, even if, there can be differences between how comfortable somebody is with their body and the language they want to use for their genitals or their sexual parts, and then somebody who's maybe not gotten to that place yet, right? Like partnering with somebody who's trans, who's comfortable with that versus not yet. How would a cisgender person best support their partner in that exploration?
Well, I think that if you are intimately partnered or even, friends and part of the support network of someone who has come out to you about wanting to transition, I think the best thing to do is just to ask, how can I support you? There is a really neat article online that I think is most Googleable if you search for how not to say the wrong thing.
Okay.
The original article, and it was about trying to navigate being a person in the network of caregivers and loved ones around someone who is very, very sick and having crises.
Okay.
And really what the conclusion of the author was they drew these rings around the person in the center and put people, sort of close to that person, the immediate family and caregivers, and farther away, the friends and the support people for the insiders and etc. And the author of the article said, my philosophy basically is comfort in, dump out. So if you have stresses and worries about what's going on with the person who's at the center of this system, send them outwards toward people who are less involved. If you have comfort and support to offer, send them inwards. And I think that's a nice metaphor for when we are close to someone who is coming out as being transgender and looking at what that means for them, that if I, as a cisgender person, have fears for that person, if I have uncertainties, if I have worries about what is this going to mean for our relationship, particularly in the early kinds of days, those are things that I want to dump out. So I want to go and get a therapist and talk with. I want to talk with close, trustworthy people in my own circle with my transgender partner's permission. I want to not spend a lot of time dumping it on that transgender person, because they are the person who is really at the center of this incredibly important and perhaps difficult kind of emerging situation. So what I want to send their direction is comfort. How do I support you? How do I best advocate for you?
Okay, so the cisgender partner in this case would not necessarily expect to process their stuff around the transition with the transgender person, right?
Yeah.
Like, let's send this out and deal with that elsewhere.
Yeah. And so let's take the situation of someone who's cisgender, who's been partnered with someone for perhaps a while, and the person says, I need to tell you something. This is what's going on with me, and this is where I think this might be going. if that relationship is going to be ongoing, at some point, I think, and I'm a couples therapist, by the way, primarily in my work, I think it's incredibly important that that couple find support of a good, affirming, knowledgeable, supportive couple therapist, because the couple is going to have processing to do together about what does this mean for us? How will we do things going forward? Can we go forward? But, that is specifically couple work. But the individual kind of stuff, I worry this person might be making the wrong decision, or I'm fearful what will happen to them in their job, or I'm struggling with my own feelings about, the transphobia that I'm noticing that I have, all these responses. That is stuff to take to your own therapy and your own support network.
Okay. All right. So what are some of the challenges that might come up for a couple like this around sex, physical intimacy?
Sure. Well, so first of all, I think it's important that cisgender people who have a partner who may be heading into transition should know, first of all, your partner's transition is not about you. It's not something they're doing to you. It's not something they're doing to spite you. It is about them and, a very personal process of understanding and relating to their gender and their body and their gender role in the world. A person's transition also is not a sexual fetish. There is a difference between someone who wants to cross-dress, to dress in the clothes of another gender, sometimes just for personal comfort, sometimes because it's sexually fun and arousing for them. That is a completely separate situation from someone who is transgender and wants to transition. Sometimes there is some experimentation with, oh, this is just me, this is just my style, or this is just fun and sexy, as a way of sort of working up to, actually, I'm having some feelings about my gender. But cross-dressing and transition are very separate things. And another thing question that actually comes in sometimes from partners of transgender people into my office. Transition can have social and medical components, but not all transitions for people involve medical things and surgical interventions. I think that's what cisgender people tend to think about and focus on the most, what the media focuses on. But actually, the social piece in which someone says to other people in their life, you need to understand that I am a woman instead of a man. Here's the name that I want to be called. Here's the pronouns that I want to have used. Here's how you're going to see me looking and dressing, and etc. Here's the bathroom that I'm going to be using. Those things are actually much more a component for more transgender people, because not all transgender people want to have some kind of a medical intervention, and not all transgender people even transition, which is another whole conversation. But but the social piece is really often much more critical and much more sort of upfront for folks. And so I think it's important, to understand what exactly is the person that you're in a relationship with envisioning when they talk about transitioning. And that may change over time. I
was going to say, they may not know that right away, right?
Yeah, they may not know that right away, or they may not feel comfortable sharing that immediately. Also, cisgender people should know that a person's transition usually does not change who they're attracted to sexually and romantically. And this is where sometimes cisgender folks get confused, because the way that we label sexual orientation has to do, it's located in the person's gender, right? Yeah. I am a woman who is attracted to men, therefore I am heterosexual. I am a woman who is attracted to women, therefore I am lesbian. I'm a woman who's attracted to people of my own gender and people different from me, so I might identify as bisexual or pansexual or some other term, right? So because we locate that label in people's gender, when a person's gender identity or gender role changes, the words may change, and then people get confused.
So can you give me an example?
Yeah. So for example, if I used to call myself a straight man, right, because I was perceived as male, the doctor said, it's a boy. I was living as a male, and I was attracted to women, so I called myself a straight man. Once I am now living my identity as a woman, I'm now a woman who's attracted to women. So I might instead call myself lesbian. So the label shifts, even though the people that I'm interested in hasn't shifted. Some people who transition find shifts in who they desire as well. But that is not about being transgender necessarily. Because this is something that happens to cisgender people too.
Yeah.
someone comes to a different place in their life and they recognize a capacity for attraction that they hadn't recognized before, or they recognize, oh, I've always been attracted to varieties of people, but I'm in a place in my life where I really am mostly interested in insert gender here, right? So that's not about being trans. That's about the fact that we are learning that sexual attraction can be fluid.
Yeah, and I really appreciate you making this distinction between our gender identity and our sexual orientation. And while they can seem entwined, somehow they really are distinct. And so,
right, they're separate kinds of things.
Yeah. Hi, it's Jessa here, taking just a quick break. Thanks for listening so far. I wanted to let you know about the sex quiz that I've put together called How Healthy Is Your Sex Life? I've taken a close look at the typical ways that I see couples get into trouble with sex, including avoidance, neglect, negativity, distraction, and boredom. And the free quiz will score your individual results based on these factors. And then I provide my recommendations and ideas, including my top 10 sex tips, which will help you make instant improvement. If you'd like to take the quiz and see how healthy your sex life is, you can do it right now at sexhealthquiz.com.
So, when we get into issues that come up, particularly around sex within a couple, let's say we've got, and this is true whether someone is transitioning in a relationship or is in a relationship having already transitioned in some way. This is just kind of across the board. A couple of basic things. One is that transgender men who still have their ovaries and their uterus can get pregnant if they have sex with a partner who produces sperm.
Okay.
Even if that person is on hormone therapy, which would be testosterone for trans men. Testosterone may reduce the possibility of getting pregnant, but it can and does happen, both planfully and accidentally.
Okay.
Also, trans women who are still producing sperm, who still have their gonads, their testicles, can get people with ovaries and a uterus pregnant, even if they also are on hormone replacement therapy.
Okay.
So the kinds of hormone blockers, the testosterone blockers that trans women may be taking, estrogen and progesterone that they may be taking, may change a bit how their genitals function in terms of arousal and orgasm. But if they're producing sperm, they can get a person with uterus and ovaries pregnant. So those are two basic, safer sex kinds of things.
Yes, that's good to keep in mind. Yes.
I think it's important to know. Another thing, just generally to know, is that some transgender people are very comfortable looking at their bodies or letting partners look at their bodies. Other people are not so comfortable or may go through periods or be at places in their life where they're not so comfortable. And so they may prefer to have sex partially clothed, with dim lighting or with no lighting, under the covers, etc. Again, this is not exclusive to trans people. Cis people sometimes have these feelings too, but it's something to be thoughtful about with trans partners because they may feel particularly vulnerable about their bodies.
Okay.
If you're in a lasting relationship with someone who's transgender and your transgender partner is very narrow in the conditions under which they're willing to have sex, it's got to be in the dark, it's got to be with all the curtains closed, etc. And you can never, look at my body in this way. Couples may find it helpful to have the support of a therapist in broadening their sexual repertoire over time, just like any couple that's kind of in a narrow rut around sexual interactions. But please don't push someone to disclose things about their body or to show you their body or to let you touch parts of their body, especially if you are very early in a dating or a sexual relationship. Don't do those things. And even if you're in a long-term relationship, recognize that's something that needs to be co-navigated in an atmosphere of safety and trust and support, not something to be demanded or, pushed at.
Yeah.
Some other things for folks who have had surgery, some kind of medical intervention beyond hormone therapy. Anybody who's had any kind of surgery, and this is transgender people and cisgender people, we know that when you cut into your body and your body heals, maybe it'll heal and over time you'll hardly know it, and maybe you'll have some kind of visible scar, some kind of internal scarring or adhesions. You may have changes in sensation around the scar, around the surgery site. So oversensitivity or being very numb, and ways that looks particular to some of the types of interventions that transgender people might have. Anybody who's had chest surgery, whether their chest was reduced in size or augmented in size, can have issues with scar tissue and particularly with nipple sensation.
Yeah.
So some versions of chest surgery actually take, this is fairly graphic here, they actually temporarily remove the entire nipple and areola, the colored area around the nipple, and they literally set them aside in a dish and do whatever augmentation or reduction they're going to do, and then they attach them again. And this, of course, it severs nerves and may, over time, improve, but can for many people leave their nipples without much sensation at all. So someone who may have enjoyed having their chest touched in certain ways before surgery may not enjoy it afterwards. And a person who likes to touch their partner's chest or stimulate their nipples in a certain kind of way may find that that's itchy, painful, uncomfortable, or just doesn't do anything for them. So you need to ask your partner, how do they like to have their chest or their breasts touch, and what kind of touch doesn't work for them?
Yeah.
Transgender women also may have had surgery on their face, on their necks, etc., so they may have visible or invisible scar tissue in those areas, which may affect how they like to be touched, kissed, etc.
Right.
Genital reconstruction for transgender women can produce results that look pretty much identical to cisgender women. Our ability to create vaginas and vulvas is generally very good, but all bodies are different and all healing processes are different. Most transgender women who have genital surgery choose to have a vagina created, which has depth, which you can penetrate with fingers or a toy. Some do not,
right.
But that's less typical. But so all transgender women who have some kind of depth to their vagina are going to have periods of months or even years after surgery when they need to do regular care of their vaginas to help with the healing process. And for some women, this may be something that they are very private about. They don't want to talk about. They don't want you to be around when they do it. Others may really welcome or appreciate support from a partner, particularly in a long-term relationship. So you may need to ask, is this something that you want me to be involved in or no? How can I support you, right? And again, there may be scar tissue, there may be differences in sensation, etc. So ask your partner to teach her, how does her vulva work for her? How does her vagina work for her? How does her clitoris work for her? What kind of touch she likes? And, depending on how recent or long ago her gender confirmation surgery was, that may be something that's still changing for her. If it was fairly recent, pretty well established.
Okay.
And for transgender men, genital surgery is less common because constructing a penis that is more or less identical to what some people are born with is still really very much in transition itself. It's just not super great results. Some men find that when they go on hormone replacement, when they go on testosterone, that their body changes enough that it works for them in terms of how it looks and feels, the kind of sex that they want to have. Some men choose to use like a strap-on dildo or prosthetic penis, and some don't. Some still like to receive penetration, and some do not. And some men who do choose to have genital reconstruction, they may have various prostheses, internal or external, that they need to use when they want to have an erection. And so, again, if you're partnered with a trans man who's had genital surgery, ask him to teach you about how his body works and what kind of touch he likes, and what to expect, when the two of you have sex.
Right. Are there statistics on, do most people that go through transition either hormonally or surgery, do they maintain orgasmic ability, sexual arousal function?
That's a really good question. What I'll say is this: if those numbers are out there, I don't know about them. My sense, although fortunately it is changing rapidly, but is that the sexual medicine and sex therapy fields really have largely neglected transgender people up until extremely recently. And so whatever studies are out there are perhaps still going on or emerging. I know that it is the goal of surgeons that do gender confirmation to retain sexual sensation and functioning, because that's something that most people want from their genitals.
Yeah, right. That's important.
Right. So I think that's a primary concern, but I don't know whether people have actually released statistics or studies or not. Certainly any kind of surgery, and this is true for cisgender men who have prostate removals, or for women who have various kinds of infections or adhesions or birth injuries. Anytime you operate on a part of the body, you cannot guarantee that it's going to behave exactly the same afterwards as it did before. So I'm sure that there are people that have difficulty with sensation, that have discomfort, etc. But I honestly don't know what the statistics are.
Okay. Any thoughts about? Well, I don't know if you covered the points you wanted to make about the changes with sex.
Well, I also want to say this, that I think when a lot of cisgender people imagine being intimate with a person who is transgender, whether that's initiating a relationship with someone who they learn is transgender, or being in a relationship with someone who then comes out as transgender and talks about transitioning, I think that it creates a lot of anxiety for cisgender people, because we as a society have all of these stereotypes, fetishes, negative beliefs, and really kind of cruel and prurient attitudes about bodies that are different in all kinds of ways, bodies that are different in size, different in weight, different in color, etc. But we're particularly, I think, stereotype and fetishize transgender people's bodies. And so as soon as we even start to entertain the question, well, what would it be like for me to be attracted to someone who I learned was transgender or who came out as transgender? I think all of that stuff goes crashing in, and it creates a lot of anxiety and its own kind of negative reactions, because we're all marinating in a culture of transphobia. So I think a place where a lot of cisgender people go as soon as they start entertaining that question is they start wanting to go to this place of, declaratives. Well, I am only attracted to X. I would never be attracted to Y. Often focused on people's genitalia. And I just want to point out, kind of generally, and this is something that I point out to all kinds of sex therapy clients, not just folks who have questions around, their gender or partner's gender or whatever. Our capacity for attraction is really interesting, and I think a little bit unexplored. We have all of this interest in labeling. This is my type. This is who I like. This is what I want from a partner. And yet, I have seen so many instances of people who said, well, I'm never going to be attracted to a higher weight person. And then they meet someone and there is that chemistry and there is a friendship or a relationship. And then all of a sudden the attraction is there. Or I am just not into butch women. And then again, something happens, you connect with someone and suddenly there's a possibility you hadn't thought of before. So attraction happens well before people get their pants off. Most people are not exclusively attracted to the 3 square inches that are between a person's thighs. We're attracted to lots of parts of people. And so just instead of trying to go, well, would I be attracted to a transgender person? What would that mean? What would happen if that were true? Instead, I encourage people to sit with, what would happen if you just let yourself experience attraction without making up your mind about what it means in advance? What would happen if you just let yourself sit with that and have that experience rather than trying to do something about it or declare something about it?
Yeah.
When people are in a relationship with someone who comes out as transgender while in the relationship, I think it's really helpful for the cisgender partner, instead of rushing to declare, well, I am only attracted to, or I will never be attracted to X or Y, why not allow yourself to sit with the ambiguity? I'm not sure what my attraction for this person is going to look like.
Yeah.
Sit with that ambiguity and see what happens over time. Be curious. I'm often saying to clients who are in all kinds of ambiguous situations, do I want to be in this relationship? Do I want to look for a new job? Be a scientist. Do some research. Gather information. Get up today and say, how do I feel about this? How do I feel about it tomorrow? How do I feel about it the next day? And then look back and say, here's some data that I've gathered. Let yourself have a process and learn about, in this case, who your partner is becoming, and see what happens for yourself, and process those feelings of fear, of disappointment, of grief, of disgust, because that comes up for people with a therapist. Dump it out and stay curious and open to the process that's happening between you and your partner, because you're allowed to be attracted to who you're attracted to. You're allowed to have attachment to your own sexual orientation and your own identity. You're allowed to have feelings about transition. And why reach a conclusion about what that means before you have to,
Right, like prematurely. That was what I was going to ask you about, is for somebody who might be struggling with attraction, their own sexual orientation with a partner who's come out as trans. And I love your message. First of all, take your time, right? And be curious and stay open and realize that we may be more fluid than we would have imagined. Right.
Right.
And I love what you're saying too, is it's not, our attraction is not just based solely on the crotch. So
and it's a process, of the process of coming out as transgender and moving into, living authentically as yourself for, a transgender person does not happen overnight. It is often a process of months and years, and in some ways it's often ongoing, in the way that sexual minority folks talk about how, like, you never stop coming out because you're always living in a world that assumes you're straight. There's a way in which, you never stop living pieces of being transgender in a cisgender world. So day one does not require an announcement correspondingly on the part of the cisgender partner about what they're going to do about it.
Yeah.
And there's actually a really lovely workbook that just came out. There's actually a few resources that I can share here, but specific to this one, Joe Green published a book, I think last year, called The Trans Partner Handbook. That's just some basic knowledge and things to think about. And then just in the last few weeks, there's a workbook that came out by D.M. Maynard called The Reflective Workbook for Partners of Transgender People. I literally got my copy yesterday and was so excited. And it is pages and pages and pages of self-reflection that you can work on solo or with a therapist, conversations you can have with a partner, as they go through their process and you go through yours, about, what does all of this mean? How are we going to navigate different things? What are the possibilities that are emerging? And I just spent about half an hour flipping through it last night, and I really because it really is a reflective process, not a declarative process.
Wonderful. I will make sure to put links to those on the show notes too. Those are great resources.
One other piece that I want, I think, to say too, and this is kind of larger, like we're talking specifically about sex here today, and about having sex with your transgender partner. But I think it's important for cisgender folks not just to learn in general about transgender experiences, but to learn about cis sexism and transphobia and trans misogyny. These are all terms that are emerging for how we talk about different ways that society is set up to privilege cisgender people, to assume that everyone is cisgender, to punish and other people who are transgender, and particularly places where negative attitudes about women and negative attitudes about people who take on some part of womanhood or a woman's role, people who are effeminate or femme, particularly people that were assigned male who come out as transgender women, how all of that negativity kind of accrues around them. A writer I really recommend on this is Julia Serrano. She has several good books, and she has a great blog and Twitter account, and she's a phenomenal writer about all of this. But this is stuff that transgender people are living on the daily. And so understanding how this stuff kind of functions structurally is important. What that helps us do is to understand kind of on the ground what we talk about: microaggressions, little devaluing or denigrating or excluding kinds of things that people do and say against people who are marginalized. If we learn to spot those things, then when they happen, and they will happen to our transgender partner, then we can also spot them, and maybe we can take action, calling them out or turning quietly to our partner and saying, I'm here with you, whatever kind of support and affirmation your partner needs. We can also work on catching ourselves when we commit them, and we will, and we do. I do, and I'm, always trying to work on being a better trans ally. And look at how you can be an ally in your everyday life. Your intimate relationship with a transgender partner does not stop at the door to your house, and any more than their life stops at the door to your house or your apartment. So things like, what are your employer's healthcare policies? Do they cover transgender related care? And if not, are you going to advocate for that? Well, my partner's getting her care through her own insurance. Yeah, but why should you work at a place that disconfirms transgender people's needs without saying something, right? What places do you go that only offer gender segregated restrooms, and how are you going to advocate to have gender neutral restrooms? What policies do your politicians, local and national, endorse and support? How does your local school district accommodate and affirm gender creative children or not? Take stands on these things, because transgender people do that work all the time to try and make the world safer for themselves and other people like them. And it would be nice if cisgender people would do some of the work too. And I think that's a really important way for cisgender people to, say to their transgender partners, you matter and you're important to me and your life is important to me, and people like you are part of my community of care and concern.
Yeah.
So it may not seem directly sex related. How does it relate to my sexual relationship with my partner, to find out what my local school board's policies are on bathrooms for trans kids? But as a sex therapist and a relationship therapist, I can say that about a large portion of the sexual issues that come into my office are actually relationship issues that are just sex.
Totally interwoven. We can't separate one from the other. So I'm so glad you're talking about that. So where can people learn a little bit more about you and other places they might go for information and support?
Sure. Let me recommend 3 other specific book possibilities. One that just came out is called Trans Love. It's trans/love. It was edited by Morty Diamond. It's all kinds of essays on the experience of being trans or genderqueer and having love and intimacy. It's wonderful. Lots of different stories in there. Great place for cisgender people to listen to trans voices. And another is called Queer Sex by Juno Roche, Roche, which is conversations with different queer and trans folks about what their sex lives look like. And then the third one, for partners of transgender women, or for people who are sexually attracted to women, period, who may someday be partnered with transgender women, it's called Fucking Trans Women by Mira Bellwether. And it's published in softcover, but it's really a zine that she put together a number of years ago, talking about the nitty gritty of different ways of having sex with trans women. There's no corresponding one for trans men that I know of. I hope there will be someday. Not yet. Right. I hope that trans guy or guys will put one together, or for genderqueer people, by the way. But I think those are 3 really great books for cisgender people to read and understand, because they're talking about these questions about how do I relate to you and your experiences and your body, and how do we want to talk about things, what words are we going to use, and what kinds of things can happen between our bodies that are affirming and enjoyable, and etc. So those are all really great. As far as finding me, my website is drsheilaaddison.com. It's Dr. Sheila Addison with 2 Ds. And I also have a small consulting business called Margin to Center. Still working on the website for that one, although you can find me indirectly via Facebook there. I have a professional Facebook page for myself, which is pretty searchable. And I have a private practice in Oakland, California, where I see, couples and individuals, and I supervise some interns that work with me, and I share great queer and trans affirming space with some wonderful colleagues. And if I don't have openings, when people seek me out for therapy, I always try to help people with appropriate referrals. I teach and train at agencies, largely around the Bay Area, but I have been flown out places to do trainings. I was just in Albany, New York last November to do a day-long training for their sexual orientation and gender identity program in the School of Social Work and local trans agency, Choices Consulting. So I'm available for hire.
Good to know.
And I train on a variety of things about sex and relationships and diversity and allyship. I also, another piece of work that I do is I offer the Ally Skills workshop in both not-for-profit and corporate settings, which really focuses on how we can take action when we are the people with privilege in a situation, rather than always putting that work on people who are marginalized.
Right.
And it's a terrific workshop that is, I think, really informative and really helpful and gives people stuff to act on in their own, schools, communities, and workplaces. So
Goodness,
find me online.
Wonderful. Well, thank you so much. This was a wealth of information, and in some ways, just the tip of the iceberg. But
yeah, right, exactly. Thanks for the opportunity.
Yeah, of course.
It's been wonderful.
You've been listening to Better Sex. Please visit our website, bettersexpodcast.com, for show notes and additional episodes.
And that's a wrap for today. I really hope you enjoyed the episode. If you are enjoying the podcast, if some of this material resonates with you and you would like to make a difference and make sure that this keeps coming out in the world once a week, ongoing, there are a couple things you could do to show your appreciation. The first would be to go to iTunes and rate and review the show. That really helps us be found by new listeners when you review the show on iTunes. You can find a link at bettersexpodcast.com/iTunes. The other thing I want to invite you to consider is becoming a Patreon. For a small monthly pledge, you get some benefits. So for $2 a month, you get advance access to every single episode. For $5 a month, you get a chapter of my upcoming new book. And for $10 a month, I host quarterly get-to-know-you and question-and-answer chats over the web, and you get invited to that. I would love to have your membership in that, become part of the Better Sex family. You can find a link at bettersexpodcast.com/Patreon, which is Patreon. Again, thanks for listening. I'm glad you're here. Feel free to comment, ask questions, get in touch. I'd love to hear from listeners. Thanks.